back in a real office and wanted to answer a question about confidentiality. Confidentiality is super important when you come to therapy, of course, because how can you feel free to talk openly about private or painful things unless you understand the privacy that's provided to you? One of the most valuable things about therapy is the confidentiality. And what that means is that basically there's only a few exceptions to how much privacy you have. In fact, we cannot even confirm or deny, are you even in treatment? If anyone had asked, is this person a patient? Absolutely no response, cannot confirm or deny. You would get, and your therapist should give you a copy, electronically or paper, the limits of confidentiality form explaining all of your protections and your rights, because confidentiality is a key and core legal part of professional counseling. Now, what are the exceptions to confidentiality? That's obviously important. They actually happen pretty rarely. One is an actual emergency, so medical or psychological imminent emergency. And so that could be a specific threat to somebody else with a plan, or an actual inability to keep oneself safe because of being so impaired that someone may be doing something super dangerous imminently. This does not mean that if you just share that I've ever had a self-harm action or thought about suicide ever, that doesn't mean that it's going to be a violation of confidentiality or an immediate call to a hospital. Absolutely not. Most of us do sometimes have these thoughts or have had small risky behaviors that do not mean an imminent medical emergency. So that's a difference. And if you're not sure, you can really ask your therapist and you can make a choice about what you feel like disclosing now or not. But your therapist's job is to make sure that if you become so impaired mentally or medically that they would break confidentiality to get help. But that's actually pretty rare. The other thing is if there's a mandated by law report. And that means there's several types of people who are under special protection because they're not able to fully protect themselves. So that means if a therapist hears that a child, an elder, or a disabled adult is being abused or neglected, that would be a mandated report to get help for that person. What does that mean if you're in therapy and you're under 18? Then it becomes a matter of, when I see a client and there's a guardian or a parent, we make it really clear what we will be sharing or not. That legally the guardian would have what's called privilege, which is access to records and such, but that almost all of the time that I've worked with families or with children, we make an agreement that we are not going to be sharing everything from session, because for counseling to work, a person needs to feel that they have privacy and protection. Now, something else that could happen that's very, very rare is if the records were subpoenaed by a judge for some reason. It's quite rare. I've had it happen like once in almost 20 years. And even then it didn't even go to court. We didn't wind up releasing records. So that's a pretty rare and complicated thing. But if there's a subpoena for records, your therapist would still consult with a lawyer first about trying not to release any of your information, and if they did, they would release the bare minimum, meaning we're not going to share everything that's ever talked about. It might be only this piece that might be relevant to this legal situation. However, if you want your records shared, then with your permission, you would sign a release of information form. And so that's when we would release information because you want us to. That could be for you're applying for accommodations for leave of absence, maybe from school, or a temporary disability from work, or you would like us to share some information with your medical doctor or a new therapist. So with your permission, you would sign a release and we could do that as well. And one other thing to think about is if you're using an insurance company to pay for counseling, then they would have the information that they need for billing purposes. And that's between you and your insurance company. They usually do ask to verify things like, did you come to session? How many sessions? Is there a diagnosis? What kind of treatment are they paying for? And sometimes there are people who actually choose not to use their insurance from work or whatever for that reason. But generally, they are also bound by confidentiality laws as well. All your medical information in the United States is bound by confidentiality laws. And I know for some of us who are immigrants from other countries, the laws may be very different. So I hope that this explanation kind of helps give you a sense of what it's like if you seek counseling in the US. There might be some slight differences depending on what state you're in, and you can always call the Board of Behavioral Science or the Board of Psychologists in your state to clarify some things. That we take confidentiality very seriously. If a therapist were to break your confidentiality and it was not for imminent emergency, mandated report, or subpoena or private insurance reasons, I would be subject to serious penalties, even potentially prison time, or thousands and thousands of dollars of fines. It's something that should be taken very seriously. And if you feel that a therapist has breached your confidentiality, that is something that you can consult with also the board, licensure boards. That one of the reasons people do choose professional therapy over, say, just like a wellness coach, is that you're seeking that guarantee of professional behavior and adherence to licensure standards of care and experience. And so you deserve that in your treatment. You should feel able to be open, to be able to talk about things that maybe you don't feel comfortable sharing. You don't want to burden family, or they wouldn't have the expertise to understand what you've experienced. And so please do take that into mind. Feel absolutely empowered to ask to carefully read over the limits of confidentiality when you start counseling. Feel free to ask questions during therapy about what is okay to share, what might happen if you share certain things, and also feel empowered to also ask questions with licensure boards and read up on those things as well. We want you to be an empowered client, because a good therapist should be helping you to be empowered in all areas of your life. Hope that's helpful, and definitely, if you have other questions about therapy, drop a comment or a note, and I'll put some more resources in the description as well.